time now to bring back two really good friends of the show, Martha and Elliot Clopin. Join us to talk about patient assistance programs covering expensive eye medications. Good to see you guys.
It's nice to see you too. Happy New Year.
Happy New Year. Is this the first time that we're meeting?
Yes, yes.
What? Okay, well, I like this. Okay, Elliot, let's just jump straight into it. My first question is gonna go out to you. Now, is it true that more than 2.1 million people across the U.S. suffer from diseases of the eye?
2.1 million. I think actually Martha is gonna start with that one.
Oh, okay.
Martha?
Yeah, because I've been doing a lot of research, and according to the American Association of Ophthalmology, they say over 2 million people have eye diseases that need to be treated with prescriptions.
Okay, perfect. Now, what are some patient assistant programs that we should, consider look into? What do you think?
Well, a lot of people have called us, and this has been recently, where they're telling us they have to make a decision whether to put groceries on the table or take expensive medications. Some of the medications to treat diseases like age-related macular degeneration, that's a big one. Age-related macular degeneration can be very, very expensive. So people have been calling us to say, hey, what can I do? I have insurance, and even with my insurance, it's very expensive. So we found programs called patient assistance programs, and those act like a lifeline to people to help them save on the cost of these expensive medications.
Good to know that there's some resources like that that's out there to help us. So what are some examples of the different types of eye conditions that is expensive to treat?
Well, the one that we've been getting calls about is called wet macular degeneration. And some of these folks have told us that some of the medications can be $2,000 per month, and they have to get actually an injection in the eye. So imagine you need an injection in the eye, and it's $2,000, the retail cost. So insurance can bring that down to maybe a few $100s, but a lot of folks, especially here in Hawaii, a few $100s, if you can save that, it can go a long way. Sure. So that's what Ellie and I do. We're on the case. We go and look for programs, and this patient assistance program has been a lifeline. Actually, someone who reached out to us, he actually used the program, and it worked well, and he was able to get these medications for little of nothing. And I think Elliot has a praise report about that.
Yeah. So tell us a little bit about that. I mean, that's kind of crazy that one, I already don't like things near my eye.
Yes.
So when you have to get an injection and then you're paying that amount.
Exactly.
So we're glad that you guys are here to tell all our Living 808 viewers about this. So Elliot, let's go more into this. What do you think?
Right, absolutely. So this individual, he was so happy to have found a program that was able to help with his prescription. So he didn't have to worry about the costs. He could just focus on completely recovering from the health issue that he had. And he was just talking about how grateful he was for the program. And it's really great to look for these programs, because people do have to make that impossible choice sometimes between choosing, are they going to be able to pay for groceries, or are they going to have to make that decision to pay for an expensive prescription medication? So talking to this individual was really enlightening, because we got to learn how it really did help somebody in real life.
I love that. Yeah. Now, who sponsors patient assistant programs, and how do they apply?
Right, so that's government agencies, pharmaceutical companies as well, and nonprofits. They provide financial assistance to patients, and it can be in the form of free medications. It can be in the form of copay assistance, things like that. And then additionally, these assistance programs, they can really be a beacon of hope for people, because people are out there, they may not know about them. They may think that they don't have a choice. So it's something that they can use.
Sure. And obviously, you know of somebody who was able to get help from a PAP, the patient assistance programs that helped him afford his medication. And I'm sure that everybody else, who have questions, concerns, they can obviously reach out to you guys, correct?
Right. Yeah, that's right. They can let us know. They can reach out to Get to Insurance, or they can also talk to their pharmacies. They can talk to their doctor's offices. They'll usually have information about these programs, and they really are lifesavers for people, particularly those if they're on limited income or if they have inadequate insurance.
Perfect. It's gettoinsurance.com, the number 2. And we also see a beautiful lady on the camera right there. So gettoinsurance.com. Reach out to our friends Elliot and Martha. They have a lot of great information that they would love to share with the community. And as always, you guys head over to KHON2.com right after, because we're going to have more information, including a recap of this segment if you guys want to learn more. So thank you guys so much for coming on, and Happy New Year.
Thank you. Happy New Year. And we look forward to seeing you. Take your medications, and they don't have to be expensive. You can use a lifeline, the patient assistance programs. Call us.
I love it. And I see what you did there.
You see?
Thank you, friends. Good to see you guys.